We're sorry to interrupt your regular scheduled programming, but there's a code 1 emergency situation occurring within your body. Your blood sugar levels are spiraling out of control, and unless you take immediate action, you could pass away within minutes. Well, thankfully, you did unclick on a link titled "You Won't Believe What Happens Next." And since you clicked on this video, we assume you're interested in what happens when your blood sugar gets too high. So let's start from the beginning. Every 5 seconds, someone around the world is diagnosed with diabetes. But what really happens inside the body when blood sugar spirals out of control? We'll cover the science, the types, hidden symptoms, complications, and modern treatments, so you can better understand this growing global health crisis. So grab a snack and get ready to learn a thing or two before we dive into it. Cells are making an energy currency called ATP. It's kind of like a battery that powers everything from your brain to your biceps. And guess what? Your cells need fuel to make ATP. Without getting too technical, your body breaks down food into smaller molecules, then absorbs them into the bloodstream. Some of these molecules are glucose, and that's great because your cells are always looking for fuel. But how do cells get access to the sugar? They need a key, and that key is a hormone called insulin. Insulin is made by the pancreas, which is like a factory that produces various important hormones. When insulin is released into the bloodstream, it unlocks the doors to your cells, allowing glucose to enter and make energy. This process is pretty awesome. Think of it like this. Then a tow truck arrives, clears the roadblock, and traffic starts flowing again. Diabetes happens when something goes wrong with this process. With diabetes, the key either doesn't work anymore or the cells don't have enough keys. Let's look at type 1 diabetes first. Imagine you've lost the key to your house. That's what happens in type 1 diabetes. Your immune system mistakenly attacks the insulin-producing cells in your pancreas, destroying the key factory. Without insulin, glucose can't get into the cells to make energy, so it builds up in the bloodstream, creating all sorts of problems. Type 1 diabetes often happens quickly and is usually diagnosed in children, teenagers, or young adults. People with type 1 diabetes need to take insulin every day because their body's Q1T make any on their own. Now, let's talk about type 2 diabetes. Here's the scenario. You've got a bunch of keys, but your cell's door has so many locks that it might as well be a gated community. Even if you keep bringing insulin to the door, it's not letting glucose in. That's what happens in type 2 diabetes. The problem isn't that the key factory isn't working, but the cells have become resistant to insulin. Glucose can't get into the cells, so it stays in the bloodstream, causing issues. Type 2 diabetes is the most common form, and most people develop it because of lifestyle factors like being overweight or not exercising much. However, genetics play a huge role too. If your parents had type 2 diabetes, your risk goes way up. And no, it's not just because they passed on the bad genes. There's actually a genetic component to it. So instead of unlocking the cells, the insulin is kind of like a bouncer at a nightclub, turning people away at the door. To help the key work again, you can improve your lifestyle with diet and exercise. But in some cases, you might also need medication. Then we have gestational diabetes. This type pops up during pregnancy when your body is struggling to handle the extra stress of growing a tiny human. Sometimes the baby is big and needs lots of sugar, so mom's blood sugar goes up. That can make insulin harder to work. This can cause problems for both mom and baby. And if you develop gestational diabetes, you have a higher chance of developing type 2 diabetes later on. There are other forms of diabetes like maturity onset diabetes of the young, known as MODY. These forms are less common and usually caused by genes linked to insulin production or action. Secondary diabetes occurs when another condition makes insulin less effective. For example, certain medications, hormonal changes, or chronic illnesses like kidney disease can cause problems with insulin. Now that you know the basics of diabetes, let's talk about the signs of trouble. If you don't manage your blood sugar, it can lead to some serious consequences. You might feel super thirsty, need to pee more than usual, lose weight without trying, see blurry because your eyes are swollen, or feel tired all the time. But even those aren't the worst of it. Those are just the tip of the iceberg. When your blood sugar is too high, you're at risk of short-term problems like hypoglycemia or low sugar and hypoglycemia or high sugar. Hypoglycemia happens when your blood sugar drops too low. This is uncommon but can happen if you take too much insulin or don't eat enough carbs. Symptoms include sweating, shaking, confusion, and passing out. While some people don't notice any symptoms, others experience increased thirst and urination, hunger, fatigue, mood changes, and blurred vision. Left untreated, hyperglycemia can lead to severe complications. In the long run, uncontrolled diabetes can cause heart disease, kidney failure, nerve damage, blindness, and even amputations. In fact, diabetes is a leading cause of death and disability worldwide, costing billions of dollars in healthcare costs each year. Now that's why it's crucial to stay aware of the warning signs. Next, let's chat about what exactly causes diabetes and who is at risk. First, your genes play a big role. Studies show that genes linked to insulin production and action are prime suspects. Then there's your lifestyle. Being overweight or inactive can make you more prone to diabetes, especially if you're already at risk because of your genes. Plus, the type of food you eat matters. A diet loaded with sugary drinks and processed carbs can put you over the edge. Some research suggests that eating lots of fruits can lower your risk of type 2 diabetes, which makes sense because fruits are naturally sweet, right? No, they're not. Actually, fruits contain compounds called polyphenols that can improve insulin sensitivity. Polyphenols basically tell your cells to open up and accept more glucose, helping to regulate your blood sugar levels. Some studies even show that sipping on a glass of pomegranate juice after a carb-heavy meal can help reduce post-meal blood sugar spikes. And as for those pesky environmental triggers, researchers haven't figured out all the details yet. In recent years, diabetes rates have been on the rise globally, possibly because of the growing number of people eating ultra-processed foods and living more sedentary lifestyles. More than half of the world's population is at risk for type 2 diabetes, and it's becoming more common in kids too. As more families eat fast food and spend less time outside, more kids are at risk of diabetes. Now, let's talk about diagnosing diabetes. Doctors use tests to measure your blood sugar levels and see if you have diabetes. One common test is the fasting glucose test, where you and eat for a while and then give a blood sample. Another test is the HbA1c test, which measures your average blood sugar levels for the past 3 months. This test uses a small blood sample from your finger prick. These tests can help identify problems early so you can take action sooner rather than later. Early diagnosis and treatment can save you from potential complications down the road. First, you can try improving your lifestyle. Eating healthy foods, moving more, and keeping a healthy weight can make a big difference. If needed, doctors can prescribe medications like metformin to help regulate your blood sugar levels. Newer medications like GLP-1 agonist can mimic the effects of a natural hormone that helps control blood sugar. Thanks to modern technology, insulin pumps and continuous glucose monitors can deliver insulin automatically, making management easier. They can analyze your eating habits and suggest personalized plans to help you make better food choices. Looking ahead, researchers are working on exciting possibilities like an artificial pancreas and gene therapy to cure diabetes. One study even found that a combination of healthy diet, physical activity, and medications can help prevent diabetes altogether. Next, let's talk about some of the latest medical advances and research breakthroughs related to diabetes. One promising development is the creation of artificial pancreas systems, also known as closed-loop systems. These devices can monitor blood sugar levels and automatically deliver the right amount of insulin, taking the guesswork out of diabetes management. In fact, a clinical trial involving type 1 diabetes patients showed that the artificial pancreas could reduce hypoglycemia and improve overall blood sugar control. Another exciting area of research is in gene therapy. Researchers are looking into the possibility of using genes to replace faulty insulin-producing cells in people with type 1 diabetes. One company called Vertex is working on a gene therapy that could restore insulin production by correcting the genetic defect that causes the disease. In animal studies, the therapy has shown good results, offering hope for a potential cure for type 1 diabetes, but that's not all. Scientists are also exploring the use of stem cells to regenerate insulin-producing beta cells in the pancreas. A study published in the journal Cell Stem showed that researchers were able to create insulin-producing cells from adult stem cells in the lab. It's early in the research process, but this could lead to a regenerative medicine approach for treating type 1 diabetes in humans. And finally, let's talk about some of the amazing stories of people living with diabetes and thriving. Despite the challenges, millions of people around the world are living happy and fulfilling lives with diabetes. Take, for example, Chloe, a young woman who was diagnosed with type 1 diabetes at the age of 15. Since her diagnosis, she has become an advocate for the disease, helping others to understand and manage their own diabetes. Through her work, she has helped to dispel myths and break down barriers for people living with diabetes. Instead of seeing the diagnosis as a setback, he decided to use it as motivation to improve his lifestyle. He started eating healthier, working out regularly, and monitoring his blood sugar levels closely. And let's not forget about Maria, a grandmother who was diagnosed with gestational diabetes during her first pregnancy. Thanks to her healthcare team, she was able to manage her condition and give birth to a healthy baby. But she didn't stop there. She went on to educate other expectant mothers about the importance of managing blood sugar levels during pregnancy and the risks of gestational diabetes. Her efforts have helped countless families welcome their babies safely and healthily. If you found this video helpful, hit subscribe, share it with someone you care about, and let's spread knowledge that could save lives.